agreement form. Step 2 of our process is called contract considerations. Before we get into that, the information shared in this section should not be considered legal advice. It's only for consideration and is meant to be thought-provoking and should be brought forward to a lawyer that is familiar with your local, regional, and state healthcare laws and scope of practice for your specialty. Any formal contract structure or content should always be developed and approved with a lawyer. But some of the legal considerations that should go into a contract like this are a limitation of liability to the extent possible, based on the laws that are applicable to you in your area. Also, a disclaimer that this is not a replacement for health insurance. And typically, because it's not a replacement for health insurance, it doesn't trigger any regulatory requirements. But again, this should be verified and spelled out clearly within the contract. And potentially also a provision outlining what is within the scope of control of the employer over the contract that doesn't disrupt your ability as a clinician in providing care to the patients. Now, when it comes to considerations as far as what goes into the contract, you want to make sure the care model is very well outlined, including if there's any access timeline requirements, the duration or frequency of appointments, or any other value-added aspects of care that will help differentiate the value of this type of a contract versus traditional services that you provide. Compensation agreement should definitely be included in any contract. There are lots of payment models and options in a direct-to-employer contract, and that is something that may vary between employers if you have multiple employers on board, or it may be something that you decide to only give one option to them because it's what works well for your clinic. But the provision should outline specifically the timing, the form, and the acknowledgement of payment and what that process looks like, who it's handled by, and in what time frame. So whether the payment model is a flat fee based on each body part being treated, if it's a flat monthly fee for unlimited clinic visits for any body part, or some sort of tiered structure based on mutually agreed upon quality targets, that's something that should be negotiated between the clinic and the employer. The last piece that should be included in the contract is what data is going to be shared and how it's going to be shared. It is helpful to be transparent with the employer that you're working with, but you want to be careful that you are not providing any protected health information or violating any of the regulations around HIPAA. But it is helpful to show your value if you are able to transparently share high-level data between the employers. Now, going back to the payment agreement, this is an example of a form that can be used to help facilitate that process. It just includes some basic information about the patient and what they're being treated for. And then the bottom section is where the amount requested is documented, when it's due, how it was submitted, and who submitted it. Now, depending on that payment structure, if it's a flat fee for every person that comes in for hip pain, then the office staff in your clinic would know that the amount requested for hip pain would be $2,000, and it's due in 15 days, so they would fill that out in the bottom there. Otherwise, if it was a different structure, like a monthly fee or something, then this form may look a little bit different depending on what the agreement says.